Check, check, mic check. 1, 2, 3. Mic check, 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 check. 1, 2, 3. Mic check. Good.
Somebody's square.
Just sit up here.
It was right here.
Oh.
You're like, oh, you're like, okay, TLA.
Breaking things.
Okay, good morning. Thank you to the media for being here today and for watching online to cover this announcement and get this important information to our LA County residents. I'm joined today by Supervisor Holly Mitchell, and we have some exciting news to announce. Now, how many of you are old enough to remember the old Publishers Clearinghouse commercials? You'd rush to your mailbox hoping to find an envelope, and maybe you'd win $1 million. Maybe after jumping through a few hoops and ordering a bunch of magazines. Well, this envelope is going to be even better. Starting next week, 134,820 LA County residents will receive one of these in the mail with no strings attached, no magazines to order. Inside, that Los Angeles County has eliminated their medical debt. Completely gone. This is going to be a huge relief to thousands of families. No one should be pushed into poverty just because they got sick or needed medical care. And yet, that's exactly what's been happening. Across the county, medical debt is crushing people. 1 in 9 adults in the county is burdened by medical debt. Many are low-income working families who, even with a lifetime of work, may never escape it. This kind of debt often gets bundled and sold to debt collectors, pennies on the dollar, who then go mercilessly after families aggressively for the payment. But we asked ourselves, what if, instead of collection agencies buying debt, Los Angeles County bought that debt? And what if, instead of collecting it, we forgave it? And that's exactly what we've done. Supervisor Mitchell and I brought forward a proposal last year to launch this initiative under our Department of Public Health with the help of the nonprofit Undo Medical. The goal was simple: eliminate as much medical debt as possible for low-income residents. Today, we're celebrating the results of that work. These 134,820 envelopes represent more than $183 million in medical debt that has now been wiped out for LA County residents. And we did it using just over $1 million county funds, purchasing the debt for less than a half a cent on the dollar. That's not just smart policy, it's smart economics. It's compassionate, efficient government at work. So keep an eye on your mailbox. These envelopes will come from the County of Los Angeles with the county seal on there and Undo Medical Debt. Each one will list how much debt was forgiven and where it was from, whether a hospital, a clinic, or care. And most importantly, this debt relief comes with no strings attached. It doesn't count as income. You don't owe taxes, and you don't have to do a thing. I think this is LA County government at its best. We're seizing an opportunity and making a smart financial decision to make people's lives easier and better. I know this is going to be life-changing for so many people, and I'm proud to say we're just getting started. We plan to help even more residents in the coming months. And now I'd like to introduce to you my partner in this effort, someone who's been a champion for equity and economic, Supervisor Holly Mitchell.
Thank you. Good morning, everybody. You want me to clip it on the? All right, we'll set it there.
Sorry.
And I really appreciate you for allowing me to join you in this effort and co-authoring the motion that brought us to the point. From my perspective, medical debt and eliminating it really is an anti-poverty solution. It's a solution or one of the tools in our toolkit as we attempt to deal with houselessness. It's a quality of life solution. It's a health solution. And for far too many residents are one medical bill away from fiscal catastrophe, from losing their house, losing their job. In 2023 alone, LA County residents held over $2.9 billion in medical debt alone. As Supervisor Hahn said, that's 1 in 9 of us when we consider the number of adults in this room. And so when you think about the proposed cuts to Medi-Cal, these challenges may get even worse. Families who once had access to essential care could potentially fall through the cracks, and medical debt is often the first sign of that breakdown. So again, you heard it. We've both been given cues. Hold up the envelope. Hold up the envelope. It's one thing I say about the envelope, couple things. I don't want people to confuse the word undue with overdue. I'm glad it's blue and not red. And tragically, right now, people are having mixed feelings about government. So I hope the county seal will reflect safe harbor and an acknowledgement of the safety net level of government that is really here to provide a resource. So it says undue, not overdue. Pay attention. And I'm also going to encourage people to open their mail. Far too many people get their mail and toss it aside. I appreciate the fact that you use Publishers Clearinghouse as an example, because that's my excuse for always opening my mail and answering every call, whether I recognize the number or not. I always think it's them coming with the check. But again, it's important to understand this isn't kind of an opt-in. It's an automatic pilot scenario. You don't have to take any action. There's no application. It is a real notification that we are taking care of your medical debt. We're not delaying your payment. We have covered your medical debt. I just can't emphasize that more. So when you get the envelope that says undue medical debt, please open it and acknowledge that this is your county government in partnership with this nonprofit organization at work. Again, I'd like to thank the medical debt collection that includes several hospitals, like my district, MLK Community Hospital in South LA, and numerous community-based organizations are working with the county to help us reach this goal of relieving hundreds of millions of dollars in medical debt. The city of LA was the first city to join the county in adopting the medical debt ordinance, and we're hoping that many other cities do this as well. I've sent letters to cities in my district, including Culver City, Gardena, and Inglewood, calling on them to adopt similar ordinances to extend these protections to our shared constituency. So it's my hope that cities all across LA County will consider joining us in this effort. Removing the burden of medical debt changes lives and gives people the freedom to seek care when they need it, without fear of bills they cannot pay. We've heard horror stories of adults putting their children, of seniors seeking medical help, not calling an ambulance out of the fear of what that charge will be, and if they'll leave that debt to their family member if they were, to pass. We hope this frees people and gives you the opportunity that if you need medical help, that you seek it without the burden and fear of having debt that you cannot cover. With that, Supervisor Hahn and I would like to introduce to you Dr. Davis, and we'll hear directly from Dr. Davis what the county's Department of Public Health has to share more on the details of this medical debt relief program. Dr. Davis.
Okay. All right. Sure. Good morning, everyone, and thanks for being here. I want to start with Ruth. Medical debt is not like other debt. It's something you don't ask for. It shows up after an emergency or an illness. And it's just when you're trying to get better that you get this thing that says you owe all of this money. And then it sticks around. It can wreck your credit. It can add stress. It can make it harder to get back on your feet. And in a county as big and with as much opportunity as Los Angeles County, no one should have to choose between paying a medical bill or buying groceries or keeping a roof over their head. And too many of our neighbors right now have that burden. And that's why we're here today, to let people know that relief is on the way for many impacted by medical debt. And before we move on, I do want to absolutely thank our fearless leader, Supervisor Janice Hahn and Supervisor Holly Mitchell. Both have continued to champion efforts to protect health as well as financial stability for all our residents here in Los Angeles County, and we deeply appreciate that. I also appreciate Undue Medical Debt and the coalition of health and community partners and those who've been trying to bring about real change and lasting change as we try to tackle this issue. Now, we just released a report, and it's a report on what we see with medical debt. And I want to share what we know about the problem here. Now, the scale of the issue is staggering here in Los Angeles County. As mentioned, 1 in 9 adults in LA County has medical debt, totaling over $2.3 billion. Now, this is more than a financial issue. It's really a public health crisis about the impacts that having this type of debt can have in terms of the choices that you make. Now, we know that medical debt increases the risk of food insecurity, skipped care, and housing instability by up to 3.5 times. Now, it's alongside chronic diseases such as asthma and diabetes in terms of the scale and the impact. Now, the burden of medical debt is not evenly distributed. It disproportionately impacts our Black and Brown communities, American Indian, Alaska Native, Native Hawaiian, Pacific Islander, and multiracial families, and families with children, and those with lower incomes. Now, while insurance alone doesn't prevent it's definitely needed. Now, people with coverage, whether they have Med-Mal, Medicare, or private plans, still face challenges, but the risk is significantly lower. And if you are uninsured, we want you to reach out to an enrollment counselor. They can help you, in terms of getting the coverage that is right for you and that works for you. And we know that if you're an uninsured adult, you're over 9 times more likely to carry medical debt than someone who has Medicare. Now, even though the uninsured rate declined, medical debt increased. And heightening the need for both stronger coverage and deeper reforms, we must protect and expand access to insurance while improving how financial assistance and patient protections are implemented on the ground. Now, the program is about more than just erasing debt. It's about changing the conditions that cause it in the first place. That includes ensuring everyone has easy access to medical care and health coverage. Now, if you don't have coverage right now, check with an enrollment counselor and they can do it for you. Now, again, if you receive a letter, open it. As said, it's not a scam. It means that all of your medical debt has been completely abolished, and there's no action required. The debt is gone, and it won't appear on your credit report. This is what equity looks like in action. Removing barriers, expanding opportunity, ensuring that a single hospital visit doesn't lead to long-term hardship. Thank you again for being here, and I'd like to introduce Courtney Story, Vice President of Initiatives for Undue Medical Debt.
Good morning, everyone, and thank you for having us here today. My name is Courtney Story, and I am the Vice President of Government Initiatives at Undue Medical Debt. It is an honor to stand with Supervisors Hahn and Mitchell and Dr. Davis to mark this first round of debt in Los Angeles County. Nationally, more than 100 million people struggle with medical debt, including 1 in 9 in LA County, as you've heard, where according to the Urban Institute, the average person with medical debt in collections carries a balance of nearly $2,000. Half of adults in this country report not having $500 on hand for an unexpected medical expense. This is not just a financial issue. It is an issue of public health. We know that medical debt is not a debt of choice. It is a debt of necessity. It forces people to delay or forego care. It can impact credit scores, and it weighs most heavily on communities already facing systemic inequity. At Undue Medical Debt, our goal is to change that. We use government and philanthropic funds to purchase directly from hospitals, health systems, and the secondary market, and then we abolish it. People qualify automatically if they earn up to 400% of the federal poverty level, or if their medical debt exceeds more than 5% of their income. Once we purchase the debt, it is erased. No application, no red tape, and no strings attached. And if that debt was on someone's credit report, we work to ensure it was removed. Starting early next week, more than 134,000 residents across LA will be receiving letters in the mail informing them their medical debt has been erased. These letters represent more than $183 million in total relief for LA County residents. This first round includes debt purchased from the secondary market as well as from one local hospital system, and we are so grateful for their partnership. Thank you again to Los Angeles County for their leadership in addressing medical debt head-on. We look forward to announcing additions of relief as the program continues. Thank you.
Thank you. Can I add one? I don't think that any of us made. I just thought about it as I listened to you.
Can I hold my envelope while you make
Yeah,
this
please
point?
do. You know, I'm proud to represent the 2nd District, and we know that medical disproportionately affects lower-income residents, communities of color, and those already navigating our healthcare system, insurance, and limited resources. The other beneficiary of this program all those health facilities, those hospitals, those clinics in those communities, provide services to this population who need resources too. We know our Medi-Cal reimbursement rate here in California really does cover the cost of care. And so this is also going to help those health facilities serving those underserved populations, keep them whole. Because if I'm carrying the debt, that means the clinic or the hospital didn't get paid either. And so it's a win-win all the way around for the individual who will have their credit score, thank you, hopefully restored, as well as the healthcare provider facilities to receive payment for the services that they've rendered. So it's a win-win all the way around.
Great. Questions for the doctor? Oh, yeah.
Yeah,
In
yes.
what past, I didn't understand what parameters were used to choose 132,000 people when there's 881 persons that owe money. And also, I wanted to ask if there's a Spanish speaker. I'm with Univision.
So first question, we purchased this from secondary market providers as well as one hospital system. So if you held an account that was in collections, one of those providers, and you met the criteria, then your debt was abolished. As we continue to partner with more health systems, as the program goes on, additional relief will happen, and we will let folks know that those hospital systems participated, and they'll have that opportunity to have that debt forgiven as well.
But what's the criteria?
So if your income is percent of the federal poverty level or below, or if your total medical debt exceeds 5% of your income. 5%, yes.
Supervisors, can you talk about how important a program like this is considering cuts to the federal level?
Well, I mean, this is such an important program. We in the County of Los Angeles are the safety net for our 10 million residents. I mean, we are here to catch people before they fall through the cracks, both financially, mentally, housing-wise. We do everything we can to help particularly our low-income residents of LA County. This program is going to make a difference in someone's life. Once we can relieve them of this deep burden of debt, they are going to be able to, live their lives more, they're going to be more happy, their well-being, their mental health, all will be improved. I mean, the whole family gets crushed under medical debt like this. We believe this is as important as our guaranteed income programs, anything that we do to really uplift residents of LA County, and this is a huge part of it.
I would just add that when we brought this motion last year, there was no indication that we could be facing the elimination of Medicaid as we know it. So we were solving for one problem. I think now, given the reality of what we're experiencing, today's front page LA Times, the state's general fund, state's budget, they're looking at reducing and cutting back eligibility to Medi-Cal. Programs like this even more relevant and timely and critical, because there is a possibility that there will be more people left uninsured without any support in seeking covering their medical costs, and could in fact incur more debt. So that wasn't our reality when we brought the motion. We were curing for one problem. It's all the more important now.
And then just a quick follow-up, it says you plan to eliminate $1 million in debt, contributions from philanthropic partners, hospital, and health funds. Is that a solid source of funding? Obviously we're always concerned about funding. Is that money that can definitely be secured?
I mean, we think that, is that something, I mean, we think that those are our partners in this, and that they will also see the benefit of being our financial partner. So we feel pretty confident that that's solid.
And hope that philanthropic dollars will grow to help us.
Good morning. Two questions. One, do you know how rare or common it is for a county like Los Angeles to initiate a program and carry it out like this? And two, do you have any demographics on the people who are receiving these letters, whether insured, underinsured, not insured, ages?
Good question.
You want to talk about
You want to talk about how many counties, or are we the first? Or?
Sure. I would represent and do work with other counties and jurisdictions across the country. I will say that in LA County, one of the unique features of this program is that it is.
Start over. Good information.
Apologies. Sorry, my name is Dr. Naman Shah. I'm with the County Public Health Department under Dr. The program that we have in LA County under the supervisor's leadership includes not only relief, but prevention. And I think that's relatively unique across the country. We recognize that we don't want to keep doing this again and again, and so you have to turn off the tap. And we're fortunate to have a wonderful set of partners in our community partners and our hospitals who are undertaking measures to reform their charity care and financial assistance practices so that fewer people end up with medical debt to begin with.
We work with over 22 cities, counties, and states country to do medical debt relief programs. LA is definitely at the forefront of the innovation and what's on this issue. Demographic data will be available. It typically takes 3 to 6 months after the abolishment is complete for that to come back to us. And then we have to do our own internal work on it before it'll be turned over to the county, and then it will be made public.
Good.
Just last question, does it include undocumented people?
We do not collect any information on immigration status.
Okay. Did we have a Spanish speaker? You got the answer. Okay. All right. Thanks, everybody. One more time.
Hold it up.
don't even
Undue
have one.
debt, yes.
Right.
Yeah. Oh my
All
God,
right.
my debt's been
We
relieved.
could have had him stuffed. We should
Yeah.
have done that.
Right.
Undue debt, yes, it's very important.
Okay. Thank
This
you.
is good, this is news coming in your mailbox.
That's right. That's right. Thank you. Okay.
Thank you very
Yes,
much for the
thank you.
partnership.
Yes, so
Yeah,
great to meet you
exciting.
guys.
Yeah. Thank you. This is great. Thank you. Good job.
Great.
Thanks.
Thank you so much. We're
Yeah.
very
Let's get a
excited.
piece of good.
I know, right?
And please encourage your constituents to respond to our survey
Oh.
as well, so we can get testimonials and response.
So,
We should have mentioned that.
yeah.